internet. I know I did not do a 13-month update because it kind of was irrelevant, but I wanted to do an update for after I saw the plastic surgeon, which I actually did today. Weight-wise, I've been hanging out around 180. Sometimes it'll fluctuate 5 pounds. Just kind of depends on that time of the month. And nothing really has changed routine-wise. Between the last time I did a video and now, I think I've done one other 10K. I went 6.3 miles. It's my furthest. Nowadays, I kind of run 3 to 4 days a week. 3 miles, 3.5 is kind of my average. Sometimes I'll go 4. I don't need to push it because 3 miles is kind of my comfort zone. And that's kind of weird to say considering I was not a runner before. And here I am. But anyway, I've learned some good things at the plastic surgeon, and what he was telling me was that because my weight has been more or less stable, and at this point I could lose, you know, maybe 5 more pounds on my own. Could be more than that, but for the most part, nothing's going to change unless it's actually cut off, because I saw him to have him look at the skin that I have, and I have a lot of it. I'm not going to show you, but trust me that it's there. And it causes a lot of discomfort, a lot of back pain, a lot of skin rashes, things like that. So what he actually recommended was to do a lower body lift. And so what that would basically do is take the skin from the top of my thighs and pull it up, and from my waist and pull it down, and it would be all the way around. So it would be like a 360 kind of body lift. It's a pretty big surgery, but it would be one that would help resolve a lot of the problems that I'm having now. And I mean, the one thing that kind of struck me was that he says, I can see the lean body that you have. I can see it. You can't, but I can. And that was kind of validating for me because, I mean, I have worked really hard and I've been working out, and he says, I see the muscle tone. I can see it. I can see it in your arms. I can see it in your legs. It's there. It's just hiding because you're carrying around all this extra skin. And this is one way that I can deal with it. So today, we submitted for insurance approval the lower body lift. I don't know what's going to happen as far as what they are going to do. It's possible that they'll pay for all of it. It's possible that they'll pay for some of it. But what he basically said is that I'm not going to be happy with just like a tummy tuck because it's not enough. It's not going to resolve the problem. We'll see. I'm hoping for something good because the extra skin really does kind of make me miserable. I live with it. Obviously, I have been for a while. Deal with the rashes as they come. I get them on my belly button, which is fun. Been documenting it every single time it happens. But really, it's just validating for me. Again, and I said this before, but it's like I put in all this work, and now it really is my extra weight in the form of excess skin, and that's what's holding me back in that regard. And it's nothing about diet, it's nothing about, you know, not enough or too much exercise, it's the skin. Once I get it gone, then that'll free me up for just for a lot of things, not just like exercise-wise, but just being able to be comfortable. My back will stop hurting as much as it has been. A lot of other things will be relieved. So I'm hopeful. If all goes well, I'm hoping to have this done in May, maybe June. The procedure is a big one, and it requires at least a month of healing time, and that's a lot. And that's one thing that kind of scares me because I've got 3 kids, and I don't know if I want to put that kind of pressure on my family for that. But then on the other hand, it's like, well, I mean, this could make a big change in my life and ultimately theirs as well. So I don't know. I mean, it's probably something that we're going to have to talk about, and we will talk about, but it's at least a positive step forward. And I was really happy that the surgeon didn't say, well, no, you definitely need to lose 20, 30 more pounds. You're not there yet. What he was saying is, yeah, you are there. It's not going to get any lower, maybe 5 pounds lower, but it's not going to get a whole lot lower because all it is excess skin. And no matter how much you diet and exercise, it's not going away. And so I kind of feel good. And I know that I look so much better than I did before and I'm healthier, but sometimes that's not enough. You know, you can hear other people say it, but just to hear that kind of validation to say, I mean, that's really, medically speaking, this is what your body is dealing with. So it was just a big positive. So fingers crossed, send me your prayers, your good thoughts, that insurance will agree to pay for this body lift. It would mean the world to me. It'd be just kind of the icing on the cake. I think eventually I want to take care of the extra skin on my arms. I kind of have a lot of bat wings, which my son enjoys squeezing and playing with, which I love, of course. But eventually, that's something insurance doesn't usually cover. I know that. It's like a $3,000–4,000 procedure, so it's nothing that I'll be like, hey, I'm just going to go drop $3,000 that I don't have. But maybe someday I can look at that. I'll have some excess skin on the inside of my thighs. I have big thighs. I've always had big thighs. That maybe someday I could deal with or not. I don't know. Down the road, maybe. But my first concern is my stomach and that whole area, just to give it a good lift and make walking easier, make running easier, just make everyday life easier. So anyway, that's my update. I don't have a lot beyond that. I mean, that's kind of the big deal, but feel free to ask me questions. I'm doing some research now into the lower body lift. I've done some, but I'm doing more. I know it's a big procedure and it's going to involve a big incision, but I'm ready for it. Whether I'm ready for it on the day of surgery, I don't know. But I'm hopeful going forward. So ask questions, and until I have an update for anything, I will see you later. Bye.